Right. This is KMTV. We are broadcasting to you from Minneapolis, and today is December 1st. It's War AIDS Day, and I have with me the uh, West African HIV Task Force. They are here to discuss the issue about HIV and AIDS on the celebration of World AIDS Day. As you know, all around the world, the day December 1st is being commemorated and more awareness is being put on this day. And so, on behalf of the KMTV team, I now turn this presentation over to the West African HIV Task Force based in Minnesota and around the world. You guys take control.
Thank you for having us. Hi, everyone. I'm Emma Bola, and I'm the Executive Director for the West African HIV Task Force. And I would just turn it over to each of my colleagues to be able to introduce themselves. We want to have a brief discussions around our history, what we've done so far, some of our wins, and how we've been able to increase HIV awareness amongst African-born communities in Minnesota. So I will turn over to Kumba to introduce herself, and then we can just popcorn it over to the next person.
Hello, everyone. Thank you for coming. My name is Kumba Kanu, and I'm currently serving as the Director of Clinical Services. And we're so excited for the World AIDS Day today. We've been working on this HIV awareness in our community, and we hope to share some good news to you guys today. So welcome.
Uh, Hi everyone, my name is Jefferson Dennis, and I'm the director for finance budgeting, also do community engagement. Been doing this HIV work for as long as I can remember. Again, as we celebrate what is there today, is the HIV and AIDS is still around us. So as we discuss it, I want to encourage you all to join us as we will discuss how you and I can help work to prevent or reduce or stop new cases.
Mama, do you want to go next and introduce yourself, please?
Thank you very much. This is Mamadi Bangali Sise, Director for Community Engagement. I've been with the HIV Task Force from the very first day to now. And our work and our intention here is to make sure that we reach as many African-born men and women, educate them, test, and make sure that our community has the right information around HIV AIDS. And also, we also provide education and also distribute preventative items that will allow you to protect yourself in a situation that we all normally get involved with every day and night. Thank you.
Iju, you want to go next? You're muted. We can't hear you. There you go.
Good evening to you all. My name is Iju Shaw. I'm the Director of Logistics. I've been part of this HIV West African Task Force for so many years with this group, and we have done a lot for the community through education, through outreach, testing, and all that. So here today is the World Health Day, AIDS Day. So we are asking you guys to join us to discuss how to do our work, because we are doing it, but we need you guys to tell us what you guys need or what you guys think, how we'll do it better. So we are so happy to be here to discuss these issues with you guys on this day. Thank you.
And then we have one other person, right? is correct.
I think Kev should be on, isn't?
Jeff is here, right? So can he introduce himself?
Hello, everybody. Good evening. My name is Chris Jallo. I'm head of the Sierra Leonean community in Minnesota. It was a pleasure for me to join the HIV task force. Actually, my journey or our journey has been on for quite a long time. This all started when we had the Ebola outbreak in West Africa, and most of us decided to come together to put up an educated way of reaching out our people how to take care of themselves. So thank God Ebola went away. And then we turned to the face of HIV that we know is plaguing our people here and back home. We decided to do it because we can help and protect and inform our people. And that's why everyone you see here is committed to this work to make sure our people get the best information, the best resources that are available if for any reason somebody is positive. We've been doing this for 5 years and it's ongoing and we'll continue to do this. So the community outreach, I would say, is on all of us, especially African born men. We are very reluctant to test, but thank God we have tried so hard over the years to break that barrier. I'll wait and hear from you all. Thank you all for being here.
Thank you for that introduction. So I'll just go over briefly the task force history. Like my colleagues have said, we're all community members. We're passionate about this work because we saw a problem and we wanted to address it. So I'll go over the history briefly, why we are here, where we came from, where we're going, and then we'll have a panel of discussions around what we have done over the years as a team to be able to bring HIV awareness and also address hesitancy around testing for HIV and getting people into care. So, as a brief history of the West African HIV Task Force, as my colleagues alluded to, it started all in 2016 when I started my doctorate dissertation with Hennepin County Department of Public Health, primarily the Ryan White program. As you all, if you don't know, the Ryan White program is a federally funded program to be able to help people who are positive with HIV live healthy and productive lives. And through this program, people get um, testing and social services to be able to help them manage HIV. And so when I started my dissertation with Hennepin County, we knew that HIV was prevalent in African born communities. But then the issue became, how do we work together with African born people themselves to be able to find or form um, community led solutions, because all of the things that were done prior to 2016 wasn't working. Okay, the disease prevalence was high, which I will show you, but it wasn't working. And so, with my dissertation, I started engaging community leaders who were part of the Minnesota Task Force for Ebola, the Minnesota Ebola Task Force, which was a team of African-born leaders who worked with the state and communities to be able to address Ebola. And even though Ebola was predominantly in West Africa, Minnesota has a high population of West Africans, so there was always a fear that Ebola will come to Minnesota because of the travels between West Africa and Minnesota. And so these groups were engaged at that point. Imam Dukli, Abdullah Kitama, Mamadi Sese, Iju, and Keith, they were part of the task force. And they were the ones who brought this idea around having another task force to be able to address HIV. Okay? And so that's how we came about. Someone needs to mute their phone. Mama D, you need to mute yourself. And that's
Yeah, you can
how
go ahead.
we started the task force. And so I just want to show you a brief glimpse of where we come from and um what oh, I have to update it to this for my computer. So just give me 1 second. Um okay. It won't let me show my screen without saving it here, which is fine. I can do it. Um give me 1 second. Oh, share my screen. I can do it. I'm sorry. Okay. Um
For politics, entertainment, news, and business. And this is KMTV. We are on your screen, we are everywhere. The best online Liberian platform you have. Make the best use of it. My name is Frank Adams, and I endorse this channel.
okay, I'm back on. Sorry. Yeah, share my screen and it kicked me out of um the presentation. But let's try this one more time. And I think this is important um to do. Oh, there it is. Yes, I have it now. So yes. Can you guys see my screen? Yes.
Okay, yeah, we can.
Yes. Thank you for bearing with me. So based on what I was saying, back in 2016, when we started looking at HIV, if you see here, African born, we're in the purple here. So the prevalence, the incidence of HIV, which means the new cases, was pretty high compared to other populations, especially when you normalize it to how many African born people are in Minnesota. And so if you look around here, 2016, when we started, HIV in African born people, that year, there were the highest cases were diagnosed. I believe 66 cases were diagnosed. And so when we started the work as the West African HIV Task Force, we had the highest amount of new cases in over since 2010. So that's what, 12 years. 2016, that was the year with the highest HIV cases amongst African born people in Minnesota. And since we started this work, we've seen a decrease in amount of new cases, the number of new cases every single year, except for 2021, which primarily was because of COVID-19. A lot of people didn't test in 2020 because of the lockdown. And so when we started going back to normalcy, people started testing, and then we had this spike in HIV. But that was primarily because of the pandemic, and that was in line with other STDs, syphilis, gonorrhea. We saw a spike in STDs post COVID-19, and that's consistent with the other um, STDs. And so, what we are trying to say to you here is that when the task force work started back in 2016, when we started talking about how do we lead a community-led solution to be able to address HIV amongst our people, we were at the highest with 66 cases that year. And subsequently, we will talk about what we've done. But what we've done is primarily have our people who are trained clinicians, who are trained public health practitioners, who have not only the expertise but the lived experience to be able to talk to others around HIV. We've seen tremendous amount of increase in people who are testing. There's still some hesitancy there, but we've seen people more likely to test over the years, which testing is a form of prevention, which have resulted in people knowing their status and they can be able to do things to be able to prevent HIV or transmit it. Okay. So this is what I just wanted to show to you guys. And here, this is just amongst African born about annually, women have, women are more likely to test. But if you see here, when we started this work that year, women had about 33 new cases in African born women. The cases have been declining like that of men. Men, it started low, but then it went up, but it's coming down. Both women and men in the African born communities, the cases are going down. If you look at the trend over the last, 7 years since we started this work, cases are going down, which is a good thing. Okay. However, and this is where I will stop before we go back to our panelist discussion, and we have 45 minutes to do that. Even though new cases are going down, if you look at African born, which we are in the purple here, the prevalence is still the same. Prevalence and incidence are different from an epidemiological standpoint. Incidents are the number of new cases you find every single year. Prevalence is total cases, new and old cases. So even though we have reduction in the number of new cases that we have identified African born people on a yearly basis, we still have the same prevalence, meaning that there are still people who are living with HIV that we still need to find and get them into care. And so I'm going to stop right there. And just this is a good segue into our discussion around why do we do this work. We have seen some positive results, but the work is by far no means done. It is still, you know, a work. We still have to work to be able to make sure we end HIV amongst African born in Minnesota. So I will stop sharing my screen, and we'll start our panelist discussion. And this is for our team. We'll go around. If you want to answer the question, feel free to. The first question is, describe your journey with the West African HIV task force. I will start with Kumba, then Jefferson, Mamadi, Iju, and then Keith. That way, so we can all be able to chime in where we came from and where we are right now.
Thank you, Dr. Bowley. So I am a nurse practitioner. I work in primary care. I work in the clinic, and I also do geriatrics, which I see patients in the assisted living and the elderly. So my work with HIV was very limited, but I also do community work. I am with the Sierra Leone Nurses Association. I was leading that, and then I heard about the HIV task force. Actually, the first time I heard about it, it was an event that Dr. Bowley had put together, a testing event. And I went to that event, and there were many positive cases I remember. And I asked some questions, and eventually I joined the team. And for me, HIV affects all of us. Everyone knows someone that has HIV. It affects the whole world. It affects you. It affects me. So that was my motivation for joining it. And there has been a fight for HIV for a very long time. In our communities, they used to think that HIV is a death sentence. When you have it, there's no way out for you. But we've come to realize that HIV, when people have HIV, it's just like having any other chronic condition, like having diabetes or hypertension. And if someone with HIV is taking good care of themselves and they're taking their medications the right way, they even live a better life than others who have other chronic conditions. So I joined the task force to help create that awareness in our community and also to help reduce the stigma that we have in our community about HIV. There's one thing that I always tell people when when I'm doing HIV education is that the disease itself doesn't pick whether you're poor or you're rich or you're beautiful or ugly. It attacks everybody. Anyone can catch it. The only thing that separates us from people that get care is because they have access to care and we don't. And when you don't have access to care, you can have the virus in you and you don't know about it, and it can turn into AIDS. So our work at the task force was to create that awareness and to tell people that there is there are resources out there. There you will live a meaningful life if you're, even with HIV. So, and the first step to that is testing. And I'm proud to say that the HIV task force, we've tested over 1,200 people since I joined the task force. And we've created awareness. We're able to link people to care. And I see the teamwork and commitment that the members have. And for me, that's my journey. And we keep doing the work because we've seen there's progress. We've seen the impact that our work is doing in the community. The numbers are declining. We still have a long way to go, but I think we're on the right path.
Thank you. Jefferson, and then Mama D, and then Egypt, please.
Thank you, everyone. Again, this is Jefferson. My work with HIV started many, many years ago. I remember back in, that would be like 1993, one of my in-laws, when I was still back in Africa, one of my in-law contracted HIV. And at that time, we were very naive to the disease. We did not know how to relate to people. So that young woman, she was stigmatized. We blame her for contracting the disease, and she was treated so badly. And and I saw what the disease did to her because we were ignorant about the fight of HIV, the fear, when I was fortunate enough to move to the United States, and I went to school, and then again, by the way, I worked for the Minnesota Department of Health as a disease investigator. So before then, I worked with the Department of Human Services. And when I was doing my master's in public health, I was fortunate enough to do my internship with the African American HIV Task Force, located in downtown Minneapolis. And again, like I said, when I went there, my goal was to specialize in infectious disease. In my when I did public health, that was my area of specialty in infectious disease. So while at the African American HIV Task Force, I begin to see the numbers. I begin to see the infection rate in especially the African-born community, and particularly in Liberia, the Liberian community. Every year, that number will be staggering, and that was concerning to me. So I told, at that time it was Gwen, but she passed away now at the African American HIV Task Force. She said, "But Jeff, you can work in your community." So when I graduated from college, I also established the African Immigrant Health Awareness Initiative. The goal was to create awareness in the community and be able to raise awareness so that our people will know that indeed there is a possibility to, if you contract any other disease, especially sexually transmitted diseases and HIV and AIDS, there is there are cure for some of them, and there are way to prevent the diseases. So back then we worked with the African the Methodist Church right on Broken Boulevard. They had I think it was 2005. They had a campaign to to reduce or to raise awareness of HIV and AIDS. But when Emma came in 2016, that changed the whole dynamic about the work of HIV in our African-born community. So my organization joined with other organizations, and then we begin to do this work. And this is what something I'm so passionate about because I saw two family members of mine die from the disease, died from HIV and AIDS. And because they were stigmatized, we didn't know what to do. So I decided to do more research and decided to work about it. And one thing that like we said, the numbers begin to pick up, and we went to places where other could not go. So that means in order for us to get our message out there, we went the extra mile. We had to go to baby shower, we went to wedding shower. I also served on the Minnesota Council of HIV and AIDS, and I brought our community issue to the council that indeed look at the number, look at the data, and see what happened in the Liberian community. But our community is not getting the resources that we need to do this work, because if we'll be effective in what we do, we need the resources. So, but like Dr. Bode corrected or displayed the data, because of what we have been doing, we are not there yet, but you can see that the awareness, the message is getting across. So your HIV and AIDS is no more a death sentence. If only you can get tested and know your status and get in care, you can live a normal, healthy life for a long time. There are a lot of other resources. We discussed how to go by. I think the PrEP, PrEP, you can get on the medication. It can also help you live a longer and healthy life. So again, we are the West African HIV Task Force. We are there to join you and make sure that we fight to reduce every new cases in our Liberian or African-born community. I will stop here for now.
Mamadi, and then Iju.
Yeah, thank you very much. Again, my name is Mamadi Bangadi Sise. I've been with the West African HIV Task Force, the Ebola Task Force as well. And I think the question here, Emma, is what really bring us into this. I always go back to how we got here or how I got here. I always tell people that I went to college for free in Sierra Leone through the Albert Einstein Scholarship. And that led me to ask myself of many thousands of refugees. I was basically one of the very few that had the opportunity to go to college for free and getting my bachelor. So I decided that, you know what, I'm going to get into community service. And when I came to the United States, or went to Hamlin, got my um, master's in nonprofit management and also a graduate certificate in economic development. So the HIV task force, especially, we started with the Ebola task force, and then we came to the HIV task force as well. It's a very difficult work initially to where we are now. It was a very difficult work for us to break through into the community. Jeff said, the stigma around HIV task force. I mean, just the HIV, the stigma. Uh, you can hear me, right?
Yes.
Okay, yeah. The stigma with HIV task force was a barrier for us. Wherever we went, people didn't want to come out. So through the community engagement work that we have done over the years, we were able to not just break into the community, but also have the different religious institutions are opening their arms to us. We have, especially young women, and now we saw a lot of African-born men coming out, to test because of the education that we have provided, to them. And I believe that this work is very critical to the this work is very critical to creating that environment where people will be very free to get walk in, and say, "Look, I want to test for HIV or I want to test for something else," because our office is right here in Brooklyn Park, 7420 Unity Avenue. You come upstairs to room 303. One of the things that we're going to be doing now is we going to set up appointment. You set up appointment, you book the appointment, and then you come in here. Somebody will be here to test, and then read your result to you. So I believe that this is a work that is very critical to our community, and I just want to express thanks to our sisters here and also the brothers, because it's not something that easy. Just like we're saying it takes time, it takes energy, and some people ask you why you're doing with the HIV tax force, what benefit you're getting from there, and I always tell them, hey, if I tell you that we have tested so many people and they have been positives and they've been referred to care and stuff like that, you never know. And even you who talking to me, you need to know your status, because uh, if you know, you're not going to spread it out. So I'm in here, and I hope and that we will continue the providing education and also doing testing in different communities, especially to the young or to the young people as well, so that we can protect our community and also educate them as well. Thank you.
Thank you, thank you. So, Ichu, please go. Let's keep our responses to 2 minutes or less, because we have four other questions to get through before we do closing statements, and we have what, 28 minutes left. Ichu, please.
I think he's muted.
You are muted.
Did you mute him?
No,
We
he's.
can't hear you. Oh, I think Iju is muted. We can't hear him.
I
Yeah, can I
think
go to?
let's
Yeah, go
go
to.
to
Kev.
Yeah.
Kiev. Go
What
ahead,
is that?
because yeah,
Text him to say
go
he's
ahead.
muted.
Let he go out and come back in. Kiev, can you go ahead?
Oh, he's starting out again.
We still can hear him. Can you go ahead while he work on his? Log out and log back in and see if it works.
Have to say you can go ahead.
Can you guys hear me?
Yes.
Yeah, you can see you.
Mm-hmm.
Hmm? Yeah, I wanted to, but I don't know if they can hear. Can you all hear me?
Yes, we can hear
Yes.
you.
Can you hear me?
We can hear you.
Okay, thank you all. I'm back again. And, as I said earlier, we've been doing this for quite a while. We all have our various joining, but the main reason is we are the only people who can stand and work for our community. I'm a member of the community outreach team, where we make sure wherever there is something going on, we'll be there to educate people, because it's not one day process, one day journey. And we are happy that the people have built us. We have built a trust with our communities. Our work is all over now. We'll go to barbecues, graduation, whatever function you have. And we always take the opportunity to talk to people. Wherever we have more than one or two people, we talk to them. Other than our personal friends and family members, we encourage to test. We think this is not the job for just the few members of us who are in this thing. This is a community thing. It's only us that can prevent or help educate our people for prevention. Because the thing is, the Department of Health in Minnesota or other health organizations, they say they've been doing this for over the years. So we came together. We said, well, if these people are doing this, we are not seeing them. So we told them we can do this better, and thank God the numbers are showing that now, because we go to where our people are. The health workers, department workers, they don't work on weekends, and we know Africans, we hang out on weekends. So we make sure we meet people on the weekends. We go to their barbecue, we go to their activities, we go to things where they are. And in the process of being with them, we have built that kind of trust. So today, we are proud to say that we are part of the global effort. But in our community, I don't want to say we are the leading force, but we are happy to be part of a community outreach group that has worked so hard to break the barriers. I've met people who said, you know what, I'm going to Africa. Can I have some preventive to take with me? I said, sure, you're more than welcome. And I can say this to everybody. If you're going to Africa, call me or call anybody, or if you don't want to call me, come to our office. We'll give you a lot of preventives to take. Even if not for you, take it for somebody who might need it. Because I know that's the situation. None of us accept that we use some of these preventives, but we can take it and give it to somebody. And that's what we're trying to do. So we're asking everybody who are live here or joining us on this community outreach to please help us reach the people we haven't been able to reach. Thank you. Our work is ongoing. You can reach us anytime at our office, and everything you do with us is confidential. I'm not a clinician, and I basically don't know anything. But one thing I know for sure, if you need help, I can lead you to the people who can help you. And that's all I know. Whatever happens after that, and the same information you get at your clinic, you getting it here. We have doctors, we have nurse practitioners. That's what I tell people. You don't want to come to us because you don't want to test them. Well, we have nurse practitioners, we have a doctors. If you go to your clinic, maybe the person that's going to ask you all those 100 questions was a licensed practitioner. So our doctors and nurse practitioners are more qualified to the person you're going to go give your information. Come to us. We empathize with you because we know your problem is our problem. And that's what we want everybody to join us to move this forward, so that our number will be way better than it is. Because if you ask the Department of Health, their statistics is always on Africans. But from what we know, we are way better than a lot of communities. So let's keep doing that, and it's only us that can stand for our people. Thank you.
Thank
Yeah.
you. So each you go next, and then we will go through the 4 questions before we have our
Yeah.
final closing statements.
Can you guys hear me now?
Yeah.
Yes.
Okay, that's good. My name is Ijo Shaw again. I'm part of the HIV task force, and I was part of the Ebola task force. My journey here, I've been I like to be part of a community since back home. So anywhere there is something for my community, I always like to be involved. So I moved to Minnesota here, just a short note. Since then, I'm be part of my Sierra Leone community, Liberian community, and other West African community. So when I heard about this HIV tax force, Emma came and talked to us about it. I was so happy because we don't have it in the West African community. We have it for the East Africans and Black Americans. So why not us? So when Emma, Jeff, and Kumba, all these other beautiful people came around and say, hey, let's do it. It was just like that was my dream came true. I want to work for my community. And I saw this type of opportunity. I just jump on it. I say, you know what? I'm ready. Anything that you guys need from me or want me to do, I'm going to be part of it. I'm so proud to be working with you guys. The work we guys are doing, we don't know the weight of it because people talk about it. They are so happy at least we have something for our own West African community. Thank you.
Thank you. And I would just say on that note, this team has been together through thick and thin over almost 7 years. We do argue, we disagree, but we do it respectfully, and we understand that we all here are experts in what we do, and we respect each other. And so I just want to say thank you for keeping this work going and moving on and serving our community. So quickly, just an overview of what we do. We do three things mostly. We educate people around HIV to be able to bring awareness around HIV. HIV and AIDS are not the same thing. HIV is the virus, AIDS is the condition. So we try to test people so that if they are positive for HIV, they can get into care so we prevent the formation of the condition, which is AIDS. The other thing we do is so the first strategy we educate people primarily to increase awareness around HIV prevention and care. The second thing is do we provide testing. Most of us here were trained by the Minnesota Department of Public Health to be able to test people. We test either by a finger prick or through saliva. And within 2 to 10 minutes, if it is a finger prick, within 2 minutes, you get your results. If it is a saliva, you get your results in 10 minutes. But those results are confidential, meaning that we know who you are, but we keep it within ourselves, even within our team. There are restrictions. Only people who are testing will know who you are. And then if you're positive, the third thing we do is that we link you to care. Kumba, like she said, she's a nurse practitioner, board certified, and so she is our clinician on the team. She is the one responsible for case management, and then we link you to care. And then the last thing we do is that we follow up with you, making sure you have the resources you need to be able to stay into care, supporting you to find food and other resources for you and your family. So primarily that's what we do. And we'll leave our contact information. We have an office space. You can meet us, call us if you want to chat. We can come to where you are. As he said, we meet people where they are. We work around the clock. We work on weekends. We all have our families, but we make time for the people we serve. And so the next question, we have 20 minutes to get through 4 questions. So we will keep it to 1 minute short for each person. So please time yourself. I don't want to interrupt anyone. So the next question is, what are some of the highlights? I've explained what we've been through, what we do as a team, but what are some of your highlights over the last couple of years? And why do you think we were able to achieve successes in some of the things that we've done?
Um,
Anyone?
yeah, I'm gonna go. Like I said earlier on, that we've tested over 1,000 people. And even during COVID, this team find a way to look for events that are going on in the community, and they do outreach. Sometimes we'll have 2, 3 events, and the team will, want to go for it. And like we said, testing and early intervention is the key with HIV. When you know your status, if you're positive, you get into care. If you have HIV and you have not tested and you don't know, it can take up to 10 years for people to start having symptoms. And during that 10 years, you don't have any symptoms. You can be walking around doing other things until it goes to a full blown AIDS. And then when it gets to AIDS, that's when people start getting sick. So I say to you, there's this saying that prevention is better than cure. When you know um, what you have, or you test yourself, that's the first step. If you have it, fine, you can start accessing care. So for me, one of the highlights is the amount of people that we've tested, and the enthusiasm of the team, and the commitment that we have working together and doing the outreach in our community. I think that's one of the highlights for me. Again, I want to say thank you to everyone, especially to the outreach team going out there, looking for avenues for us to test people and for us to provide education to people and creating that awareness. I feel like when we started, compared to now, there are more people that are willing to come and test versus when we first started. When we started, people didn't even want to hear. When you say, "Oh, let's do HIV tests," we're here for HIV tests, people run away. But now people want to come and they want to ask questions. They want to know, more about the task force, and they want to know more about the disease. So I think that's a big highlight for me.
Thank you. Jefferson, Mamadi? Sure.
Uh, yeah, so I just want to again go back and say that as a team, over the years, we have worked tirelessly. One of the things that we have been successful at is that as a team, we have been very consistent and persistent with what we do. Our messaging, have been tailored in a way that our people will understand. So we have advocated for the messaging because we have to message our work, especially to the religious community, to our traditional community, to our elders, and also with that, there have been a lot of things that we have done. If you look at the Department of Health surveillance report from 2022, you will see that there have been 12.6% reduction in new cases, and those are things that we can also, we were even highlighted in the Hennepin County report of the work that we do, and also you can see about 65% of new cases in Minnesota are people of color. So that means we still have work to do, and we still have work to do in our Liberian community or in our African-born community. There were 10 new cases from last year, 2022, in the Liberian-born community. This is not to shame us Liberians. This is to tell that indeed what we are doing, that we are succeeding because people are testing, because we are meeting people on the football field, we are meeting people in barbecue, we are meeting people just everywhere. We go to the churches, we go to the mosques, and we test you on the go. We test you on the go. So it's something that we do, and then we do it with passion. Go do it with passion, so you can see that indeed, like Emma was showing that data in 2020, the number of 2021, the number pick up, and now that number is reducing. Our goal is so that we will reach to zero new case. As we move down in the question, we'll talk more about the data, but again, I want to say that, thank you all guys for job well done.
Thank you, Jeffrey, Mama D, and Iju. Since you guys are doing the community engagement, anything, any highlights?
Yeah, I think for me, the highlight for the task force is how we be able to break through into the community, and how we were asking before whether we can go to their events, right? But now they are asking us to go to their events and see whether we can be part of, not just the event, but also to do testing as well. Yeah, especially for the religious institutions. I mean, it's just unbelievable that we will be having um, testing in the church or maybe outside of the masjid, and people just come. And another thing too for me is the only aspect of preventing the HIV, or let's just say giving materials out. People basically ask you to, give them condom, to give them lubricant. I mean, so many different questions that they ask. And some funny aspect, well, there are some women that have never seen a women condom, and when they see it, some of them will ask for it. So we have created an environment wherein people feel very free to talk to us because of the trust that we have gained from them. And I hope we can continue to do that, and also the validation from Hennepin County, for the work that we do, because we do more, and did and say I realize that we do more than we get back from them. But what they have realized is that we're not in here for the money. We're in here because we want to save our people. And they really appreciate that in so many different ways. So that's the highlight. And then the collaboration, the teamwork that we have. I hope we all can continue to do this. We should not feel discouraged. Sometimes I have to wake, Iju and Kev are very early from bed just to come out and do some work, and Jeff had to travel from San Nicolas to Morovia just to come do testing, so Yeah, so the teamwork is I mean everything have just changed in a positive way, in a positive direction, and I hope we can maintain that.
Thank you, thank you. Iju, you have anything to add so we can go to the next question? We have what 12 minutes left.
I think if we could just keep a comment on at least on 2 minutes, that would be
Correct.
good. Yeah,
Okay.
Iju is not here. Okay, so we'll go to the
yeah.
next question. What are some of the challenges? Like you said, Jeff, we have seen some positive highlights. We are making strides. We're making impact. But why, what is it that we are still having challenges with? And, why is it that we have to keep doing the work that we do, and some of the challenges we've had to date, and what we've done to be able to address those challenges?
So, Kumar, let me just quickly, then you
I-
can come in. One of the
I'm
major challenge there is that, this is why today the World Health Organization, their team has to do with community. They let community lead. And the reason why I think they chose this because bulk of the work that is being done in the HIV community or world is actually heavily rested on local community. One of the challenge for us is funding because many of us here we have a full-time job, and the other bigger organizations like the Hennepin, well, we don't want to call names here, but big organizations, they are doing this as a full-time job, but we have to do it on a part-time basis, and we are achieving a full-time result. So funding has been one of the huge challenge. Also incentives, because everything we do, we use our personal vehicles, we use our personal resources. The funding aren't enough to fund what we do, but we are going to places where people that are receiving the millions cannot go. So I just want the community to know that what we do, is a huge sacrifice. It's a huge sacrifice for what we do. So again, I want to say, we also count on the community to also support us in the work that we do. Though we are doing giving out $25 gift card when you test. Even with that, we have to push on on our funders to even increase it from $10 to $25. So we want people to know that it's a sacrifice, it's a challenge. We don't have enough resources to do the work that we do.
Okay. Kumba, you want to say something quickly?
No, I agree with everything Jeff has said. Resources is one of our biggest challenges, and we still have, unfortunately, with all the work that we've done, we still have some people who are still, stigmatized by HIV, who still do not understand that in this day and age with new technology and medicine, that you can, if you come in and test and you're positive, you can still live a healthy life, by taking your medications and going to care. So we still have people out there that have not, they don't want to test, that they haven't been tested. And if you don't test, like I said, you won't know. It's only when you test, and that's when you're going to start to actually know your status. So we're asking our community, please, like Jeff said with the gift card, we're just doing the gift card for incentives. But really, there's a saying that health is wealth. We're doing this for our own selves. When you test and you know your status, it's way better than not knowing. And if there is one HIV in a community, it's it's a public health crisis, because that one can multiply into 10, God knows when, where. And so we really have to cut this down and reduce it. And like the World AIDS Organization said today, they're trying to reduce new cases by 75% in 2025 and 90% in 2030. And that's the goal. And that's what we have in Minnesota, and that's what we have in our local communities. So we're asking people to please, when we have these events going on, come out and get some education. Just get education about resources, get education about testing, get education about the HIV transmission, get education about everything that we possibly can give you. There are resources about housing, there are resources about nutrition, there are resources about medical care, there are resources about social worker, mental health, all the resources that you think you can get it. And most times it's very affordable, and sometimes it's free.
Thank you. Anyone want to chime in on some challenges? Then we'll have our closing statements around, you know, I have the question. I will, what do you have? What's your last words for your communities? But Idri, you want to say something quickly before we go to our closing question?
Hold on, I mute.
Yeah, we can hear you now.
Okay. No, okay. Yeah, it's just like what my colleagues already spoke about. It's not an easy work, but the love of the community, that's why everybody is part of this. You know, we know the incentive we are giving to people. Some people will say, "Hey, this money is small." It's this. We say it's not the money. You should look what we are telling you. What how prevention is better than thinking about like if you need more money or need something. If you get this, you test yourself. You know you don't have it. It's better than $25. You got peace of mind. Your partner got a peace of mind. You know, we try to encourage them, talk to them about it, tell them don't look at the money, look about the message that we are giving to you guys because they they are talking about the Africans have AIDS. So at least we want to prove to them that people are testing and people that have AIDS are trying to get resources how to get cured or something. And people that don't have AIDS, at least they know they will say, you know what, I just test myself from the HIV or somewhere else. I know I don't have HIV. So we are talking to people and please want you guys, like what my colleague just said, please, when you have an event, you need to call us and tell us, hey, you guys are welcome. We can come there and be part of the team. Have fun with you guys. You know that you guys know how we do it. We go there, we hang out with you guys, have fun, discuss, and do testing and out. So please, we want you guys to help us because we are trying to do this work, but we need your help. With your help, we
Okay.
can make it easy.
Thank you. So we have one last question. So everyone on the task force will be given a minute to have some departing words for your community and for the people you serve. And so this last question, I will be the last one to close us. But the question is, what is the message? What is your message, your simple message around HIV prevention and care that you have for your community? If you want them to think about anything tonight when they sleep, what would that be? And I will start from Mama D, and then we'll go to Iju, Kiev, Kumba, Jefferson, and myself. 1 minute each, please.
The party message for our community is that we have come to a place where we strongly believe that we now have control over the way we are capable of engaging you. And you have this is part of you. And I think one thing also we forgot to say here is that the HIV task force is open for you to come and volunteer with us, as well. And you also get some incentive for voluntary, even though this is the team, but it is open to everybody. You come, you volunteer, you get what you need to get, but also you're serving your community as well. The HIV task force is for everybody. It's not for one person. It's for every one of us. So I think we we are encouraging you to come and help us help our community, and so that we can reduce the stigma as well as um, give confidence to those who are going through or may have contracted the virus because it's not a death sentence anymore. So that would be my departing word, and also to the team. Uh, I don't want anybody to give up. We have come to a place where before very few people came to our event. Now you have people asking us to go to their event, and I think we should keep that up. That would be my departing message. Also, thanks to the team and the teamwork. You know, I know I take all the blame, but that's good. Uh, but that would be my departing one.
Thank you.
Okay,
Iju?
this is Iju here. I want to thank you all. And my message here is we are here for you guys. You know, if you need any information, anything, you can reach out to us. And we want to assure you guys there is almost a cure. There is a prevention that if you follow the whole thing, you're going to be free from HIV. You're not going to be scared. That's why we are here to give you all those information that you need, about HIV. So at least you can take it to yourself, to your community, to your family, and tell them, if you got HIV, you're still not going to die. You're still going to live. So please test yourself and tell your family members the West African HIV is here to stay. We welcome you guys all to come to our office or invite us to your event or anywhere you want us to meet so that we can help. Thank you.
Thank you. Kiev? Is he here? Oh, there he is. We can hear you.
The team too loud.
So we can hear
No,
you
we can
now.
Our
hear you
team
now.
and the community is we want to do 10,000 tests to prove that we have come out of the closet about the stigma and we are willing to work to reach everybody, young, old, adults, to make sure we improve the lives of our people in our community. Nobody's going to do it for us, so it's our responsibility. Our responsibility. We are determined. To the community, my question is: are you with us? If you are not, please be with us. We want you to be with us. Thank you for this journey.
Kumba and then Jefferson.
Yeah. So I want to thank everyone again for this opportunity for us to talk about the task force and the work that we're doing. My message tonight will be to our community. This organization is your organization. It's your organization. It's my organization. We now have the infrastructure to be able to do this work. And they said if you're not sitting at the table, you're on the menu. But you now have advocates that can advocate for your community, that can provide information about resources, and can provide information about healthcare centers and link you to care. Um, don't be a fool. Even though we have a lot of resources, they said if you don't access those resources, you're a fool. So I just want everybody to have it in mind that I have to be my own person. I have to advocate for myself, and I have to take charge of my own health and make the bold step. Don't be shy. Go out there and, like some of our colleagues have said, you can call us, you can attend the event, you can make an appointment and get tested. And as I said, this is all ours. So let's make good use of it. Thank you so much.
Thank you. Jefferson?
So HIV knows no border, no color, you know, nothing about individual difference. In 2018, Dr. Bole and I were fortunate enough to be in Liberia. We worked along with the Liberian HIV work, and we were able to test in nucleotide. And we just that little test that we did in nucleotide, we were able to come up with three positive. Why am I bringing this up? Because, like I said, HIV does not know border. In 2017 or 2016, there was a report that came on the World Health Program that indeed about 45,000 Liberians were living with HIV and AIDS in Liberia. However, we travel. So, what am I saying this? Because if one person tests positive, there's a statistic that says that about 10 others might have it and they don't know about it. So as a community, I want our community to start having conversation around HIV and AIDS, especially educating our young people on having sexual education about our young people on how to prevent themselves, against sexually transmitted diseases. Because if you have gonorrhea, syphilis, chlamydia, the likelihood that you could get infected from HIV and AIDS, is high. So all the conversation, we don't talk these things on the dining table. We don't talk the things on the breakfast table with our young people. But I want our community in our churches, in our mouth. I want to challenge our clergymen, our pastors, our Sunday school teachers. Let us start having the community, the conversation in our churches. Because last year alone, there were 10 positive cases, new cases in Minnesota from the Liberian community. So we don't know. And there is an outbreak currently going on in Minnesota, in Hennepin County and Ramsey County around HIV and AIDS. So again, I want to say thank you, everyone. Hopefully we'll come back again and have a bigger discussion around, because there are a lot of information that because of time, we don't give you everything, but we appreciate our community. We love you guys. This is why we are doing this. So call upon us, invite us, we will come to you, and indeed we will together we will stop any new infection. Thank you, and thank you, and thank you.
Thank you all, and I will have the closing statements. My colleagues have said it all, and so I would just echo what they have said. HIV, we started this journey. In fact, some of us, it started even before some of us were born, 1981, up to 2003, 42 years in, we're still fighting. And it will take every single one of us to fight to end HIV. You know, it's unfortunate that we always, especially from an African mentality, we are looking to someone else to save us, especially from the Liberian mentality. We're always looking for the white person to save us, or we're waiting for people to save us. But no one can do that except you prioritize yourself and your health, as my colleagues have said. HIV is something that's preventable. If you have it, it can be treated. HIV and AIDS are two different things. And what we have done over the years, we brought awareness to be able to get people to test. It's testing is a form of prevention. We're asking you that if you are sexually active, you test every 3 months. If you have multiple partners, you need to test even more frequently, and protect yourself. Use condoms. Condoms are still, 99%. When worn properly, it can prevent you not only from STDs, but from other things as well. So condoms are still the best way to go. There's also PrEP. PrEP, I usually say PrEP is the HIV equivalent of the morning after, you know, and we really want to be careful around preventing ourselves. And so I just want to say that change typically comes from the bottom up, and that we have to take ownership of our own health, prevent ourselves from getting HIV and other STDs, work with community organizations like us to be able to bring forth the conversations, contact your policy makers, make sure that if you're not at the table, your representation is there, your voices are there, so that we can be able to move the needle, ask for more funding to go to African-born communities so that we can address HIV. But again, it will take us. The reason why COVID-19 had a vaccine in less than 2 years was because there was a public cry and people prioritized it. HIV hasn't been prioritized because it disproportionately affects people like us. And unfortunately, those who are at the top end of the scale and the decision makers often don't look like us. So then it's incumbent upon us now to be able to take on the burden to be able to protect ourselves. So I will stop here and just say thank you for your time. We will try and, in partnership with KMTV, we'll try and do this as often to be able to have discussions around HIV and take questions. But we just want to say thank you for having us, inviting us into your homes this afternoon, and primarily to be able to celebrate what is Day. And as we work every single day towards any HIV in African born communities, particularly in Minnesota. We say thank you and have a good night. Bye.
Thank you.
Bye.
Thank you to KMTV.
Oh, yeah.
He was here he probably will be booking for an hour, and I think he been here now for almost 2 hours. So again, thank you very much for your time, and highly appreciate it. And again, we look forward to working with you.
Yes. Bye-bye,
Bye.
everybody.
Thank you. Bye.
Uh-huh.
Have a good night.
Bye.
For politics, entertainment, news, and business. And this is KMTV. We are on the screen, we are everywhere. The best online Liberian platform you have. Make the best use of it. My name is Frank Adams, and I endorse this channel.
When the issues of Liberia hit the news,
what is it that we, the Liberian people, want?
the Liberian communities in the diasporas are not left out. That's why Diaspora's Talk is back on your screens on KMTV. In fact, the Unity Party is not cohesive. Be it social, political, economic, and other issues affecting Liberia and the diaspora Liberian communities.
I did not expect to even make it to Hollywood.
Joan Cyrus McGee and Nathan Charles every Monday, Wednesday, and Friday, 12 p.m. Central Standard Time, live on KMTV, Facebook, and YouTube.
I want to be arrested in the midst of my people.
As they discuss the issues, blending the voices from Liberia and the diaspora Liberian communities.
The Liberian Business Association in the diaspora should be used as a vehicle for economic development in Liberia because no country can develop without a diaspora impact.
For sponsorship, call cell numbers 612-806-5896, 816-433-3979, or better still, email us at usakmtv@gmail.com. Diaspora Talk.